a couple of things people can do even still. We have a few more weeks left, but in the meantime, we certainly recommend brief, warm shower, so not too hot, not too cold.
Easier
and
said
brief.
than done.
Right, exactly.
When
Keeping
it's
it
cold
brief
in the
is
morning
hard.
and you get up, I'm like, crank that
That's
heat.
right, that's right. And applying a really thick moisturizer when they come out. Usually stuff in the pump is not thick enough, which people don't realize.
Oh, really?
So you really want something in the jar, so something greasy, a vat of it, and just slather yourself up while the skin's still damp. The earlobes are a huge area that people forget, and we see types of precancerous skin lesions called actinic keratoses develop on the ears very, very frequently. We would have you sit here, we'd discuss your family personal history of skin cancer, any lesions that you're worried about, and be able to provide a free total body skin screening examination. Right, well, that's a good point. So, let's start out by talking about what this is. So we're talking about the chemical DHA, or dihydroxyacetone. So this is the main component that's in the spray tan, that's in the sunless tanners. It's been in commercialized products since the 1960s. Okay. And FDA approved since the 1970s.
This is in spray tans and in the lotion that you put on you?
Okay, these are sunless tanners. It is a myth that waterproof sunscreen exists, right? You'll see these water resistant.
Really?
So it's a little better than the not water resistant, but if you're in the water long enough and you come out, make sure you reapply. It's really important. It's actually part of a larger body of evidence, so it doesn't stand alone to support this. But we typically think of men having a two-fold higher risk of melanoma. If you're going very, very frequently, again, we have to be careful.
So you recommend the lotions over the spray tanning,
So the topical creams and lotions are certainly a safe way to do this.
Can you compare it to actually going out and sitting in the sun? Is it still a safer alternative than going out and baking?
It is absolutely a safer alternative to going out and baking when not inhaled.
Don't eat it.
Right.
We've learned that.
And I even brought a sample of a product for you today that has the, just for you, it has the DHA component, but it also has a sunscreen together with that product. So remember, getting that little brown color from the DHA chemical does not protect you in any way from the sun.
Right. You're not actually tan. You're still
white. That's right. There's no SPF value to it. So we brought the dermatologist office to you today.
Yes.
Right.
So explain to us what we have set up here, because these are going to be set up at different beaches. We'll get to that in a moment, but people will be able to come in free of charge to get a check.
That's right. That's right. So we're going to be offering free skin cancer screening as part of this event. These events are all over the Boston area throughout the summer, which we'll get to. This particular gadget here is a UV camera. So we're trying to pick up some early sun damage by doing this. So we'll go ahead and
so I put my chin down on here, close the eyes.
Keep your eyes closed, that's right. And quick picture, and good old-fashioned Polaroid.
And Polaroid's done in about 20 seconds or so.
That's right. So we'll let this develop. And I believe we already took
We've got a shot, too. If we can throw that up on screen. You took a look at that. This is part of the exam that someone will actually go to. So when they come in here, you'll take that photo of them, and then you'll start to assess what they look like.
And just like Julia Child, I have one out of the oven here.
So when you look at mine, which I know we had taken, what do you see on here as someone that's grown up in Florida, been exposed to a lot of sun?
I heard you grew up in Florida. So what we're looking for early skin cancer changes, really early sun damage, I should say. It's an increased risk. It's a marker for you to be at increased risk for skin cancer. If we're seeing a lot of, dark spots on the face, for example, that we are not seeing with the naked eye.
Okay, and part of the exam too, when someone comes in, you're going to be checking them for different things as well.
So we're off to that now. So after you get your photo done, I'm going to escort you into the back of the van here. We have a full exam room.
Okay. We got about 30 seconds or so left here where you can explain this, because I want to get to all the locations where this is actually going to be set up.
So we would have you sit here, we discuss your family personal history of skin cancer, any lesions that you're worried about, and be able to provide a free total body skin screening examination. We're looking for anything that you've been concerned about in terms of changes in moles, any new lesions that are cropping up. So anything concerning to you, as well as getting a chance to take a full skin exam.
And as you said, this is the dermatology office coming to you. Not only coming to you, but coming to the beaches where people are sitting out there. They may not have sunscreen on.
You're ready in a bikini. It's the perfect time to get a full skin check.
That's a good point.
This is a hot topic for you this time of year, I imagine.
It is. It's a cold topic.
It's a cold topic. Well, you're going to take us through a bit of a quick true or false quiz here, and we can give the people the info as fast as they need to hear.
Yeah.
All right, well, we'll see. We'll see how you do. All right, first up, washing with hot water is best. True or false?
That's a strong false. That's a false.
Why?
So a few things. So the very hot water is obviously irritating to the skin. It also tends to strip a lot of the natural oils away from the skin that we want there to protect us, especially during this time of the year. So there's 3 things we can do to sort of create a little happier, moist environment around for our skin.
Okay.
So number 1 is getting a humidifier at home. Consider investing in a humidifier. We want the room about 30% humidity or so.
Okay.
Number 2 is patting the skin dry very gently when we come out of the shower to leave that little bit of moisture there to lock in with a moisturizer. That's right,
Okay.
so no scrubbing.
Okay.
And thirdly, I tell my patients using a little plant mister, for example, just to spray the skin a little bit, again, before reapplying moisturizer can be very helpful.
It sounds like a lot to do if you're on the go somewhere.
Maybe not on the go. Maybe use that before you go to bed at night.
Yeah,
you don't have to walk around with
using the bathroom. I'm not going to have a mister with me. All right, next up, drinking water helps moisturize skin. True or false?
So also a false.
Really?
Yeah. So
why do they tell you to drink so much water?
Well, so we don't want to be dehydrated. Obviously, if you're dehydrated, it will affect your skin. But beyond that, drinking water doesn't really affect the moisture level in the skin itself. It's really about the natural oils in the skin that are protecting us. So that's not making as much of a difference there. Yeah.
So is there any way to affect that in your own skin, just by drinking something, or not so much?
So not so much by drinking. So what we'll talk about instead is how the things that we choose to wash actually will make a big difference in that. So. Using things that, again, don't strip away those oils, so a very mild or gentle cleanser is really important. Those are things like, I have no allegiance to brands here, but for example, Dove Body Wash, Dove Bar, Cetaphil, CeraVe Wash, all of those things that are not detergent cleansers, and avoiding those harsh antibacterial.
What if you feel like it's not getting you clean? You know what I mean?
It will. It will, I promise. I promise.
Without getting
once in a while,
too many details.
Can alternate with your soap of choice, but those tend to be a little bit more gentle on the skin.
But still enough to clean you.
That's right.
Okay, all right, good advice. All right, let's talk about this next one. Sunscreen is not needed in the winter months. I know the answer to this one.
You're sitting next to a dermatologist.
Yeah. You always need your sunscreen.
That's right. So we absolutely do. We're exposed to quite a bit of UV light the whole year round. Remember, we're getting it through window glass, we're getting it through the windshield, even when we're driving to work, driving home. Maybe not driving home these days with how dark it is at night, but so absolutely, and this is a great time to try a daily facial moisturizer with sunscreen. Kill 2 birds. We can rehydrate some of the facial skin and protect ourselves from UV light.
All right, we usually think that we're just talking to the ladies here, but the gents should be paying attention as well. Jean and BB and Brett, they need to take care of their skin, so what do they need to know?
Yeah, so...
Especially Jean.
In this case, all of these things apply to guys as well. One thing that's a little guy-specific, and I am guilty of this myself, we shave often every morning, and that can be very drying to the skin. Some people like to use an alcohol-based aftershave, so put that aside at least until the summer, and reach instead again for that daily facial moisturizer with a little sunscreen.
Okay, quickly before we let you go, chapped lips. What should you be looking for in a chapstick?
Oh yes, so classic chapstick, not so helpful in the winter.
Really?
We want to get things that are petroleum jelly based, so things like Aquaphor, for example, on the lips are ideal. Number 2, don't lick your lips incessantly, because that can really dry them out, make them very irritated. And thirdly, they sell nice lip balms, also with a little bit of SPF, especially for the slopes. It's a great idea.
Double whammy, perfect.
Right. And just remember, when you're picking your total body moisturizer, the thicker the better. We want to try to avoid the things in a pump and really go for moisturizers in a jar, like a thick cream in the jar.
All right. Dr. Joe Merola, we hope all the gents out there were listening. We know Jean was.
Great.
Thank you for being here.
Thank you. My pleasure.